I rise today to speak to an issue that I think has been on the minds of a lot of people here and hopefully people across this country too, and that is this failed Class Act program, which last week we finally got some, I think I would characterize it as good news, because I think this is a program that was destined to fail. But on Friday last week, Secretary of Health and Human Services Kathleen Sebelius came out and said, despite our best analytical efforts, I do not see a path forward for class implementation at this time. And essentially what came with that, what accompanied that, was a big and done that just doesn't add up. You can't make the math work. And I think that's something that hopefully my colleagues, as what we know now, will recognize that we ought to eliminate, we ought to repeal this Class Act once and for all. You know, that's something I tried to do as we were debating the health care bill almost 2 years ago now. I offered an amendment in December of 2009 that would repeal the Class Act, believing at the time that it wasn't going to work. And we had plenty of, at that time, evidence to that effect. Unfortunately, it was included as a part of the health care reform bill to help pay for it. At that time, it was estimated that it would generate about $70 billion in revenue to be used to offset the cost of the health care bill, or at least to put it in balance and to claim that there was some deficit reduction associated with it. Now, I think the more recent estimate of what it would generate in terms of revenues in the early years is on the order of about $86 billion. But we have all, those of us who have been skeptics about this program, suggested from the very beginning that this wasn't going to be the case, that this was in fact a budgetary gimmick, that it was going to saddle the nation with additional debt. That was what Congressional Budget Office concluded as you got into the out years. When these premiums came in, there was going to be some revenue in the early years, but when you got to the out years and the demands on the program started to come in, that it just didn't add up, and it was going to add significantly to the federal deficit. Well, I think that's a conclusion now that's been drawn even by those who supported the program. And so my thinking at this time is that we as a Senate and hopefully the House of Representatives ought to move to repeal the Class Act once and for all. We shouldn't leave this thing on the books and allow it to become an opportunity at some point in the future for someone to say, well, we ought to try and reactivate this thing or implement this thing, knowing full well that it doesn't work. And so, you know, there were lots of warning signals along the way that were ignored. There were repeated warnings by the actuary and the administration that this wasn't going to work, which were ignored by the Obama administration in their push to pass health care reform. It's really interesting to me. We did a report not that long ago. There was a working group that examined this, and the report was called Class's Untold Story. It was myself, some of my colleagues here in the Senate, some of our House colleagues that requested it, and delved into a lot of the email traffic that had occurred prior to its inclusion in the health care reform bill, and came across a number of things, a number of warnings that were issued by the HHS actuary. The chief actuary predicted at the time that this would result in an insurance death spiral. He said this could be a terminal problem for this program. The program is intended to be actuarially sound, but at first glance, this goal may be impossible. The resulting substantial premium increases required to prevent fund exhaustion would likely reduce the number of participants, and a classic assessment spiral or insurance death spiral would ensue. That was in May of 2009. May of 2009, that warning was coming from the actuary at HHS. Well, some time passed. This continued to be a part of the discussion with regard to the health care bill, and it come to July of 2009, and that actuary went on to say, and this was again after additional analysis, review, examination of this particular proposal, that 36 years of actuarial experience lead me to believe that this program would collapse in short order and require significant federal subsidies to continue. Madam President, that it would collapse in short order. That was what was said by the HHS actuary in July of 2009. And so they continued to plow forward, thinking that somehow this was going to, again, they were going to be able to salvage this program, figure out a way to make it work. August and September timeframe of 2009, the actuary again says, as you know, I continue to be convinced that the class proposal is not actuarially sound. That was the advice, the expert advice that was given to the administration about this proposal way back in 2009, and yet they plowed ahead and in December of 2009 added it to the health care bill assuming again that it would help offset the cost of that health care legislation. And at the time when many of my colleagues here on the floor got up and talked about what a great program it was and how it was all going to pay off and this was all going to balance out, we had people say that it was a critical program, that it was a breakthrough program, that it was a win-win. We had Democrats come over here and talk about the virtues of this program, I believe knowing full well that there were questions about it. Now, having said that, there was a big push on at the time to pass health care reform, and as a consequence, this piece of that reform was included in there, notwithstanding our efforts to repeal it or to strike it at the time. And so we went forward. Well, here we are now, 18, 19 months later, and full recognition of the fact that this does not pencil out, it does not add up, the math flat doesn't work. So where do we go from here? Well, in my view, what we ought to be doing is repealing this bill, which is why it seems mystifying to me that the administration is now suggesting that if Congress were to repeal the Class Act, that he would veto the repeal bill. And you know, you've got all this actuarial data, you've got all these statements, you now have all this analysis that's been done that demonstrates the very point that we were making at the initial consideration of this, and that is that it just wasn't going to work. And so I would hope, and I would invite my colleagues here on both sides of the aisle to join me in the effort to repeal this legislation. I introduced a bill along with Senator Graham back in April of this year that would repeal the Class Act. It has 32 co-sponsors. I hope we can get enough co-sponsors here in the Senate to where we can put an end to this thing once and for all. And so we're going to be looking for opportunities to do that in the weeks and the months ahead because, as I said, Madam President, this is something that clearly does not work. It has now not only has all the arguments that were being made at the time prior to its passage, but subsequent to its passage, all the analysis that's now been done comes to the same conclusion, and that is the numbers just don't add up. Now, what does that mean for the future of long-term care? I would submit that there are other things that we should do. I don't think that this is an issue that's going to go away. We have more people who are living longer in this country. Long-term care is a very serious issue. But going about it, trying to fix it in a way that would burden future generations with more and more mountains of debt, pile on their backs the cost of this thing over time, is the wrong way to go about it. And that's exactly precisely what this particular approach would do. We've had many discussions about various remedies for the long-term care issue. We will continue to put our ideas forward in hopes that we can address it as part of some bill that would take a look and examine these issues, but do it in a way that is fiscally responsible, that's fiscally sound, that is actuarially sound, and that doesn't create the massive amount of borrowing, the massive amount of debt, and put in place a flawed program that we knew at its inception was not going to work. And so, Madam President, I hope that we will put an end to this thing, that we can get colleagues on both sides to agree to that we'll be able to add co-sponsors to that piece of legislation and look for the first opportunity to repeal this legislation and make sure that we end it once and for all, knowing full well that this was a ill-conceived and ultimately would be a failed program. Madam President, I yield the floor.